Between the final week of June and the 2nd of July this year, Rwanda saw between 700 and more than 900 new COVID-19 infections daily. The 23rd of June saw 964 infections with 6,129 active cases at the time, 12 critical, and the death toll from the virus was at 397 countrywide. 1,573,227 tests had been taken, and Kigali had the most fresh infections at 326. By the 13th of July, the country had a total of 49,808 infections since the virus was first detected in March 2020. 14,643 still active and 306 of them in Kigali. 73 were in critical condition and 16 had died that day. The next day, 934 new infections were found and the infection rate climbed to 17.5%. And so the cabinet sat to assess the situation and decided to introduce new measures to fight the spread of the virus, including that Kigali City and 8 districts in the provinces go into a total lockdown for the next 10 days. This was a sort of wake-up call for the general population as to the seriousness of the situation. Honestly, the lockdown has produced good results, and the new infections we are seeing are those in their homes where they can be cared for, encouraged to engage in things like physical exercise in their compounds when they can, and not visit other people while protecting their own family members. Many people have been tested and we are now turning our efforts to caring for those who have been found to be infected, urging them to remain in their homes. We are also working harder on sensitization efforts starting at the cell level, identifying every household with infected people, with the goal being to prevent the virus from spreading. The areas under total lockdown also underwent a mass testing exercise that continued until towards the end of last week. Day 1 saw 1,997 new infections, 1,391 of them in Kigali, and 50,880 tests were taken countrywide. 15,725 cases were still active and people vaccinated numbered 406,004. Another 15,000 have since taken the jab. The 18th of July saw 2,773 new infections, 2,225 in Kigali, out of the 73,608 tests that were taken. By the next day, fresh infections in Kigali had fallen to 140, fewer than in Musanze district, which had 152 despite being under total lockdown itself. Across the country, 930 new infections were recorded out of the 8,664 tests taken, and 17 fatalities were registered. 89 people were critically ill, with 16,523 active cases and a total of 58,235 infections in Rwanda since March last year when COVID-19 was first detected within the country's borders. 1,895,926 tests had been taken as of that date of the 19th of July 2021. With the exception of the middle of last week when infection rates spiked at 1,309, all other days from the 19th saw around 900 new infections countrywide, with Kigali accounting for less than 200. An extension of the total lockdown for another 5 days starting Tuesday has not surprised many. It has helped to drastically reduce the movement of people and the sort of chaos that was helping the virus to spread, so certainly it has yielded results. The infection rates are declining without all that disorderliness. Infection rates are falling, meaning if the preventive measures are truly respected as the government urges us to do, we can beat this pandemic. The total lockdown is hard, but it is better than people getting infected en masse and dying. I would rather they extend it for another 10 days if it can save my life. This last week has seen a total of more than 2 million COVID-19 tests taken in Rwanda since the virus first emerged, and 90 of the 727 people it has killed died during that week, a total of 330 fatalities since the 23rd of June.